Hi, I'm Mary. I'm an MI coach.
Hi, I'm Lisa. I'm a healthcare provider.
You've probably heard of motivational interviewing, or for short, MI. MI is an effective way to help activate and empower your patients to engage in health-promoting behaviors. MI is not a bag of tricks or a quick fix to get your patients to do what you want. But with practice, patience, and a commitment to its spirit, MI can be a useful tool for you. Embrace the MI spirit and experience less stress in your work life.
The spirit of MI, huh? But what does that look like in practice?
That's a great question, Lisa. Healthcare professionals are trained to assess, diagnose, and treat. Often, we lack training in patient-centered communication skills. And while our intent is always to do no harm, sometimes the way we talk to our patients can cause harm. Let's take a look at some examples.
Hi, Amber. It's great to see you. How are you doing today?
Fine, I'm here like you told me to be.
You're not happy to be here, huh?
Well, I can't feel my blood pressure, so it doesn't seem like that big of a problem.
That's why high blood pressure is called the silent killer.
Ugh. Well, I am trying to bring the numbers down.
Okay, let's see how it's going. Your blood pressure today is 148/96. That's pretty high. At your last visit, it was 150/95.
It's a bummer it hasn't budged. I want to keep working on it.
Did you start the medication I prescribed last time?
I filled it, but haven't started taking it. I want to try bringing it down without medication. I'm worried about the pill's side effects.
Okay, but the medication is the most effective way to bring it down.
Maybe, but I really don't want to take them. If I lose weight, that could help. Maybe I should see a dietitian.
You could try that, but I still recommend the medication. But it's up to you. You know what I think. Come back in 3 months again, and we'll see how things are going.
Lisa, how do you think your interaction with Amber went?
Not great, honestly. Amber was very resistant to my recommendation.
Tell me more about that.
Well, at first, she didn't seem concerned about her blood pressure. Then she said she'd like to keep working on lowering it. But she didn't want to take medication because of their side effects.
And that didn't make you feel very good.
Not at all. I want what's best for all of my patients.
I can tell you care a lot. Would it be okay if I shared some insight with you?
Yes, please.
First, let's talk about ambivalence. People don't usually change their behavior with a snap of a finger. For example, going from 1,000 steps a day to 10,000 steps a day. Or eating 3 servings of fruits and vegetables per week to eating 5 servings per day. Refusing to be vaccinated to complete vaccination acceptance. Rather, people experience ambivalence about engaging in a health behavior. I want to get more exercise, but I'm also so busy with work. I don't know how it would fit into my schedule. People go through the process of change. It's unrealistic to think after one visit, people are going to make a massive behavior change.
So what you're saying is Amber is experiencing ambivalence about lowering her blood pressure. It's especially difficult for her since she's unable to feel or see her blood pressure.
Exactly. Why do you think your suggestions weren't resonating with her?
Well, she said she'd rather keep trying to change her behavior than take her medication. Although, I guess I don't know what she's been trying. I didn't ask.
Try putting yourself in Amber's shoes for a moment. What comes to mind?
Well, she's still quite young. Being on medication for the rest of her life isn't what she wants to do. When I suggested medication, it was like she became more resistant to talking about it.
This is a common experience for many providers. Is it okay if I talk to you about the writing reflex?
Sure.
There is one trap that providers often fall into without even knowing it. It's called the writing reflex. The writing reflex is when we feel a strong urge to tell our patients what to do and how to do it. When a person is told what to do and how to do it, it will often cause reactance. Reactance can lead the person to engage in the less desirable behavior with more frequency and intensity. People do this to prove they have autonomy from being told or ordered to do something different. Let's look at some examples of what the writing reflex looks like in healthcare. Offering advice or information without asking permission or listening first. The writing reflex can also be giving advice in the form of a question. So Lisa, what are your thoughts on the writing reflex?
It makes sense, and I definitely fell into that trap with Amber.
Keeping in mind the spirit of MI, how might you have had the conversation with Amber differently?
Hi Amber, it's great to see you. How are you doing today?
Fine, I'm here like you told me to be.
You're not happy to be here, huh?
Well, I can't feel my blood pressure, so it doesn't seem like that big of a problem.
I hear you. Since it isn't something that is felt, it seems like it isn't happening. What is the best thing you've done for your health since we last saw each other?
I've been walking more now that it's nice out. I've stopped adding extra salt on my food. I filled the medication you prescribed me last time, but I haven't taken it.
This is important enough to you that you've been making some healthy lifestyle changes. Way to go, Amber.
I didn't do as much as I wanted, but I know high blood pressure is bad for my health. It runs in my family, so I know I have to take it seriously. It's just really hard.
Because this runs in your family, you know the risks. You want to take it seriously and continue making changes. Now, is it okay if we talk about your blood pressure reading today?
Yes, sure.
Today, your blood pressure is 148/98. What do you make of that?
That's pretty high. What was it last time I was in?
It was 150/95.
It's a bummer it's not budging. I'd like to keep working on it.
You want to keep using some lifestyle methods. Let's say we try another 3-month trial period. What would your best efforts look like over the next 90 days?
I think I can commit to walking at least 5 days a week for 30 minutes. I could also lose some weight. Maybe I should see a dietitian?
That could definitely help. Would you like me to refer you to a dietitian?
Yes, please. I'd like to avoid taking medication for now.
I get that. I can tell that this is really important to you. I believe you are going to increase your walking and lose some weight. I look forward to seeing you again in 3 months.
Thanks for your encouragement, Lisa.
Lisa, how do you think that interaction went?
Much better. Thinking about the MI spirit and avoiding the writing reflex helped.
Great. Would it be okay with you if I shared some things I noticed?
Sure.
You remained concerned for Amber's welfare. You came alongside her with support and encouragement. Instead of telling her what to do, you accepted her autonomy to make her own decisions. You really embodied the MI spirit.
Thanks so much for your help.
Next up, we'll walk through some conversations dealing with vaccine hesitancy specifically. We'll learn more about MI strategies, including the EPE approach, scaling questions, and best first responses.